I know what you're thinking. How could a plumber be dressed like this? But anyway, how things have changed. Go ahead and next slide. I was thinking about this. You saw the slides that showed the old junkyard on this property. That's where I used to go get parts for my car when I was a teenager. So how things have changed. Well, how things have changed too when it comes to water reuse. We used to have just rain barrels where you can capture rain off your gutter, use it for your lawn watering and so forth. Well, now we've moved up quite a bit and we're able to use rainwater in a number of different installations, especially not just for gardening, but also using it back into the building. So water reuse is a real key element of our codes. Next slide, please. So there's three main uses. First of all, of course, would be non-potable uses, taking it back into the building, using it such as for toilets, urinals, some industrial uses, and so forth. Potable uses as a secondary source, we'll talk just a moment about that. And also as an only source, that also is something relatively new. All of it, of course, talking about rainwater coming off the roof. Next slide, please. We're going to move pretty quick on this. What's helped us to be able to do that? Well, part of it is that part 3 you see there is actually our state plumbing code. That was a real driver for us to be able to change the plumbing code to get water reuse, such as rainwater harvesting, into the national codes and subsequently adopted by the state of Washington. I've been able to be a part of that national and that state process, and I appreciate Dr. Ngozi Oleru, who's our division director, allowing me to be able to do that kind of stuff. It's what I love to do, and we've really been able to be at the forefront of this. So the reason why that's important is because for years, the plumbing industry kind of shied away from it because non-potable water was not a plumbing issue, so it was viewed as taking work away from the plumbers. Okay, now we have it in the code. Get the plumbers involved. Now you have the green plumber training. Hey, we're in the driver's seat now. And then our King County Board of Health Title 13, allowing potable water under certain circumstances can be used also for drinking water. And we've also done some local amendments. In fact, next slide, we'll talk about that. First of all, for non-potable, we are concerned to make sure that the two systems are separated. So you're going to have labeling, pipe color is important, cross-connection control, annual inspection required. Next, please. And then for supplemental systems, we have a local ordinance that allows rainwater to be converted to potable water for drinking as a supplement to your drinking water from the city. That's in Seattle and in unincorporated King County. And of course, there's concerns about the type of materials that you're going to use, where you're going to get it, recording it with the building so the next owners know what's there. Next slide, please. And then recently, Larry Fay, our section manager, has worked hard on getting an allowance through the Board of Health that would allow an only source in some hardship cases where perhaps they can't get a well, they got some other problems. It would be single family on a septic system that would be able to do this. So a lot of things involved there, and again, works in concert with our plumbing codes. Next slide, please. And again, in all these systems, permit is required, so we're in the work of making sure that these things are looked at, the review phase, the inspection process with our plumbing inspectors, plans that are being reviewed, and of course coordinating with other agencies and even internally with our on-site program where necessary, and the water department. Next slide. And you can just cruise through these next slides here towards the end. These are just a few pictures of what we took up on Lopez Island. We got to go up and take a look at some of their single-family rainwater harvesting programs. You just go ahead and cruise through them here. But everything from outside containers to under the building, hidden containers, filtration. I can tell you that, that we're going to make our stuff look even prettier. So it's pretty fun to be into that. But that's just one part of what we're doing in environmental health, in public health. Dr. Oleru is going to talk a little bit about what else we're doing.
Thank you, Dave. So that's just an example. Almost everybody has started by giving you an overview of what they do in their department. I just want to let you know we do everything that you do. So I claim everything that you have said. The reason why I say that is because what most people know about health, it's medical care. The real definition of health is that it is a complete state of physical, mental well-being. And if you take that definition, then everything that has been presented today is about health. And I would ask you to complete the sentence that most people have said. You get environmental savings, you get financial savings, you also get health. And so if there's anything that I ask you to walk away with today is to, when you make that statement, please include health, because that is one of the biggest savings that we get when we do sustainable development and green building. So some of the other things that we're doing in the department is actually pre-building and pre-development, which is including in the planning process healthy guidelines. So for example, we have developed planning guidelines which the Board of Health has adopted for use in comprehensive plans and for use in countywide planning policies. We are very much involved with the Puget Sound Regional Council in transportation planning and economic development. All of these things are factors for health. We also have a grant that we just received that is going to help us along in our healthy housing planning projects. And with that, we're going to be doing a pilot project with the City of Seattle to work on rental housing inspection to ensure that we have green and sustainable practices going on. The other thing that we're doing is we have piloted and continue to pilot health impact assessments. So for example, with the county, the region just received a sustainable grant through Puget Sound Regional Council, and we are working with King County Department of Transportation, Seattle Department of Planning and Development to do health impact assessment on the transit-oriented development in Northgate. Just some examples of the policy things that we're doing. So as I said before, think health also as you're thinking environmental sustainability and financial savings. Thank you.